Hi Boomers, it's Marcia, physical therapist with homehealthpt.com and my helper Tippy. I'm going to talk today about ankle exercises that you need to be concerned about if you've had a knee replacement, a hip replacement, or just any type of leg surgery. A lot of people don't care much about ankle exercises. And then on the flip side, a lot of patients, that's all they do because they're just the easiest to do. It's always going to be easier to do, going to be easier to do something with your foot that really doesn't mess with your knee or your hip. So I just want to give you some of the ankle exercises that you just want to be working on. The one that you've probably been taught in the hospital is ankle pumps, where you're pulling your foot up and then you're pressing your foot down, okay? That might cause a little bit of pain in the knee just simply because some of the muscles that you're working by doing that attach up behind the knee. But those are ankle pumps, toes up, toes down. And you really want to go through your absolute full range of motion, not just this, but pull your toes up as far as you can and point them down as far as you can. The other exercise that is really important is, I like to call them windshield wipers. Okay? So you're just taking your foot and you're rotating it in, and then you're rotating it out, almost like you're washing your windshield with a windshield wiper. I can just hear some of you now. Wax on and wax off. I guess it's not really like waxing. But I don't know if you can see with Tippy in the background. So, up and down, back and forth. And then the last exercise that you want to do is to pretend that you've got a clock down by your foot. And what you want to do is you want to outline the full circle of the clock with your ankle and try to get every last number. And you want to do that as slow as possible. If you do it fast, what's going to happen is your ankles are probably going to be out of balance muscle-wise, and so you're going to miss a few numbers, okay? But what this does is it helps all the muscles to start working together as a team, okay? So you're going to go counterclockwise. I guess this is clockwise. And then you want to go counterclockwise. Again, try and make a nice big circle with your foot. Don't rush this exercise. This is a really good exercise to contract all the muscles down in your ankle. Every time a muscle contracts, it helps to squeeze fluid out of that muscle, and swelling and edema helps to squeeze that fluid out and back up to your heart and kind of get rid of it. Okay? So up and down, side to side, and then clockwise. Not very coordinated, am I? And then counterclockwise. And those are all exercises that you can do anytime. You wake up in the night and do them. You can do them while you're watching TV. You can do them while you're sitting on the edge of your bed. Do them with your left leg too, or the leg that's not operated on. Even though your good leg is not been operated on, it's probably in need of some muscle balancing as well. So those are some ankle exercises that you'd be wise to be doing after you've had any type of, really any type of surgery that lands you up immobile or in bed. But specifically for a knee replacement or a hip replacement, any type of leg surgery, if you've had an ankle surgery or you're in a cast or what have you, it's a whole different story, and you want to make sure that you talk to your doctor or your physical therapist before you start something like that. I just wanted to show those real quick to you today. Go and visit us at homehealthpt.com. Like us if you would, share us if you would. Sign up for our newsletter. We'll give you some freebies. And until next time, this is Marcia with homehealthpt.com.